I'm Bridgid Strachan. I'm chairing a session this morning on the future crisis, the shortage of specialists. It's an opportune time for change to look at the issues affecting the supply and demand of specialists. The presentation I give today and the discussion which will take place with 6 other discussants focuses on what issues affect the shortage of specialists and what issues will affect future demand. South Africa has a very low ratio of specialists to population, per 1,000 population, and there are many factors which influence this process. South Africa also compares poorly with other countries, including developing countries and developed countries, in terms of specialists per 1,000 population. Issues affecting the supply and demand of specialists include retention of specialists, production of specialists, access, age distribution, and a number of other issues. What is required for the future is a specialist review which focuses on each specialty in detail, looking at the burden of disease patterns, service patterns, and involves consultation with stakeholders, leading to scenario planning and workforce planning modeling. This is a process which we'd like to see going forward from coming out of this conference. The discussants during the session will look at the horizon of the issues affecting specialist supply and demand. These issues include public sector issues such as infrastructure and management, accountability for funds for training, a shortage of specialists in the public sector, a shortage of posts, resource allocation for hospitals, coding, which would enable disease demand planning. In the private sector, there's issues such as tariffs and coding, the need for a forum and for a national policy on this matter. There's issues of shortage of specialist supply in various disciplines in the private sector and in some areas of the country. There's the problems of managed care administration, which burden private service providers. Payment systems affect the relationship between the specialist and the hospital, and therefore private service providers as well. There's also national issues such as the increasing burden of disease, career pathing for specialists, the quality of training, implementation of the human resource strategy and the strengthening of academic health complexes, and most critically, the issue of communication and engagement across the public and private sectors, and in particular between the National Department of Health and relevant stakeholders. We look forward to an exciting discussion this morning with a very eminent group of discussants. Dr. Carter, the National DDG for National Tertiary Hospital Services and Human Resources, Dr. Nicholas Crisp, Executive Director of EOH, who's just completed a tertiary service review for the National Department of Health, Prof. Bongani Mayosi, who heads the Department of Medicine at Groote Schuur and UCT, Dr. Adri Cook, who's from the Faculty of Consulting Physicians of South Africa, and Kaki Matlala, Executive Member of MediClinic, and Sam Machokong from the HPCSA. No doubt we'll have a stimulating and inspiring discussion. Thank you.